feel like I'm in an interview panel with the three of you.
No pressure.
Good morning. Welcome to Barbados Fertility Centre.
Thank you.
Thank you for having us.
We're delighted to talk to you today.
Yes, my name is Olivia Gittins. This is Raven Gill.
And Speak Stout. Hi.
Yes.
Hi, everybody. Welcome.
So we have, well, there's Butterfly Barbados, which Raven will give us a quick background on, but in case there's anyone watching the video for the first time.
Nice.
So, right?
So Butterfly Barbados is a trans-led civil society organization focusing on educating the general public on things that may not be familiar to them, trans-specific information, giving you details on what transgender is, non-binary persons, the struggles that we face in Barbados, how the movement is progressing, and our fight for equality. So yes, and DearUnicorn is a project under Butterfly that is the more visible component, the more accessible way of getting information and reaching a lot of target audiences.
Okay.
So yes.
And we realized that we were getting a lot of comments and questions from persons on our social media platforms saying that they don't think they can be in a same-sex relationship because they don't believe that they can have a family, and it's harder to have a family in Barbados. And obviously we can tell them and we can ask them to follow you guys, but most people are just going to click on it and be like, oh, those are nice pictures. So we said, why don't we reach out to you and actually answer you the questions that persons in the community would have. So thank you for allowing us to come here, especially given the current climate of 2020.
I know. What a difficult year for everyone.
Exactly, everyone is in difficult. So just tell us a little bit about you and the Barbers Fertility Clinic.
Okay, so we opened the clinic in 2002. Myself and Dr. Skinner are business partners, and I was from Ireland and she did her training in Ireland, and through a friend we met. And really there was no fertility service here in Barbados at all. There was a lot of OBGYNs doing a little bit of fertility, but nobody was doing IVF. IVF is a very high-tech, high-cost procedure to run the clinic. A lot of specialised staff. So you need a population of 750,000 to sustain a full-time IVF unit. So we knew from the start we would have to do what we call medical tourism, where we bring people onto the island, and in that way we were able to support Barbados having an IVF unit and also bringing medical tourists on the island for IVF. And our IVF population that comes from overseas now is over 90%. So it's a great clinic that we're able to afford Barbadians, with the support obviously of the financial input from people who live all across the Caribbean, patients from Guyana, we have patients from Venezuela, from the ABC, all with a baby I think in every island across the Caribbean, and then every state in America. A lot of Canadians. At the start we had a lot of UK patients, but obviously with the difference in rate of exchange when the pound was so strong when we first opened the clinic, but we have a lot of UK patients who come here for donor eggs, but mostly the US and the Caribbean and Canada now.
Okay. Also, for those that are not familiar with the term IVF, could you explain it to them?
Sure. IVF is an old Latin term, in vitro fertilization. It literally means in glass, because in the old days the petri dishes were all glass. And it basically means fertilization outside the body. Okay, so we take the eggs, we take the sperm, and we put them in together in a petri dish or injection, different formats. They're all plastic now, disposable plastic. Of course. And then we create the embryos in our lab, and then approximately 5 days later, we do the embryo transfer back into the womb, and then hopefully a pregnancy ensues.
Oh, okay, good. That's nice.
Wow. Okay. So
That was a lot.
Right. So we're gonna start with some of the questions. So, have you encountered any transgender persons coming for your services?
We have. We have a transgender couple that are actually pregnant. So we have a female that trans to male, and he came with his female partner. She used her eggs, and they used his uncle's sperm, and they created the embryos, and she carried the baby, and they're now pregnant. So
Wow.
Yeah.
That's definitely interesting. And also touched on a question that Olivia was trying to get.
Which one? There's so
there's a lot of questions in this field, I know.
Okay, so you said the person was female to male.
Yes, that is correct.
Right, so that means that their sexual reproductive organs are functioning to the capacity that you would like, so that the process would...
So he didn't actually use, he was the support partner, they're married, but he didn't contribute sperm, eggs, etc. There was, he was the support partner. It was his female partner that produced the eggs, and then his uncle produced the sperm for his genetic line.
Okay.
So, and then the embryos were transferred back into his female partner, and she carried the baby.
I have a question in relation to that. When it comes to, for example, like Barbados, if that situation was to happen here, would the uncle be legally still a father, or can they have...
No, we have very clear counselling when there's a third party involved, either somebody who donates eggs to a couple or somebody who donates sperm to a single woman or a couple. There's a lot of regulation that goes around with it, so they have to have counselling. They all need to know that really from the day the sperm is provided for the partner, they no longer have a legal right to the child or any resulting children. They sign consent forms after they've had the counselling, and they obviously do medical screening.
How long counselling usually takes?
Well, the original appointment is an hour and a half. They have to do quite a lot of paperwork ahead of time, and then they speak to the counsellor for an hour and a half. If the counsellor has any follow-up concerns just about the relinquishing of the rights, or the if there's any underlying factors that come up, they'll recommend another session, or as many as it takes for everybody to feel comfortable. But they do them separately, so the donor isn't
interacting with...
with the couple. So the couple see the counsellor, or the single woman sees the counsellor, and the donor sees the counsellor, but it's separate, so there's no thumb in the back kind of approach.
So this is legal in Barbados?
This is what we recommend.
Okay.
This is our requirements for people having treatment.
Okay, because I know that those things can be tricky with how the legislation of Barbados is worded very loosely to interpretation.
Correct. So we just follow we are obviously part of medical bodies, reproductive medical bodies all over the world. So we follow their guidelines, and the guidelines is very much counselling, screening, consent, and then you can proceed. And so we follow the international guidelines and the laws on that.
Okay.
The laws here are not very clear, so we follow the international ones.
Okay. So you've never had a problem in terms of the laws of Barbados clashing with the international laws?
It has never come to that. We've never been in that situation.
That's definitely good.
It's about, look, in every medical practice, there's different levels of ethics, and we hold our clinic to the highest level of medical ethics. And when you do that, you can't go wrong.
Okay. So can trans women, that's male to female, use their sexual reproductive organs to use their sperm to have children?
Yes, but the effects of the long-term effects of the estrogen on the sperm is quite damaging. So there's a lot of studies around that. A lot of studies around the fact that when the sperm does start to be reproduced again, what the normality of the sperm is. So there's definitely a lot of studies, medical studies going on around the world about that. In theory, yes, you stop the hormone treatment, and within the 6 to 12 months, the sperm should start functioning again. But you know, with the trans community, there's two factors. There's the physical factor, and then there's the emotional, psychological factor. So when I went to the last year at our meeting, which is called ASRM, the American Society of Reproductive Medicine, I did a lot of courses on the trans community, and there was a wonderful Canadian doctor there who's running a trans program in one of the big hospitals in Toronto, and she said that the hardest part is not for the sperm to start to be produced again. It's the act of then the ejaculation, because for many trans men to women, that act of ejaculation is very difficult for them. It's what they have come away from.
Yeah, the dysphoria.
Correct. Mm-hmm. And there's a lot of them will say, I'm happy to have my sperm used, but can we get it any other way besides ejaculation? So there's definitely a psychological impact as well as a physical impact that people need to consider to go to that stage. Obviously, you can take the sperm out through a needle. I know that was mentioned earlier. You can access the sperm through the testicle directly with a needle, but it's a procedure that doesn't come without its pain. But at the same time, then they don't have to go through the act of actual ejaculation. And it's the same for the men to women, is that yes, we can use their eggs, you can stop the testosterone, but then their first question always can be, would I have to get a period to do this? And the answer is still yes. So there's definitely a psychological aspect to being a trans, being on your medication for a long time, to come off it, to go through all of the hormone withdrawal, and then to have the period or have the ejaculation, to go through the process. And so this trans couple that we treated decided not to do that, decided to use his uncle to keep the sperm genetic line without him having to do that.
It kind of makes you realize that there's a lot more to it than just taking out the egg and the sperm. There's a lot of psychological aspects to it.
There really is.
Yeah, I didn't even study that part of it. I just assumed it's like you're like, yeah, I
no,
have a baby, egg comes out. There's so much more to it.
Nothing is really that simple.
Yeah, and I think that's really important for people who are watching to consider that it's not an easy fix, that it is something that's possible. But just like it takes a lot of counselling and a lot of thought to trans, it also takes a lot of thought and a lot of processing to come off that, to produce that egg or the sperm, to then go back into back on the hormones and stuff. So it is a process, and it can take a long time. It can take up to that year that we talked about.
And a year off your medication,
That's
I know
exactly.
is terrible.
Exactly. So you not only have the impact of the producing of the egg or the sperm, but you have that whole withdrawal, and you have that whole time off your hormone and all the feelings that come along with it. And obviously, you can get the depression and the anxiety that goes along with that. So it's an important process to think through, rather than just, I want to use my sperm or I want to use my eggs.
Just like up and done with it.
Yeah, it's not really. It's a process.
Yeah, because to that point is also detransitioning. So that is another part of dysphoria kicking in again.
That is correct.
So is it almost like a sacrifice they have to make to?
So they can be in a family without having to do that if they choose to use donor egg or donor sperm. And that way they can continue their life, continue being happy in themselves. But yes, you give up the genetic link, but remember that it goes back to the nature versus nurture argument, right? Are you the father or mother because you wake up at 3 o'clock in the morning and feed a crying child and change its nappy and hold its hand and take its first step? And then there's the genetic link, which is also important. It's not that it's not. It's just that it doesn't have to be if it takes so much to get to that point.
In relation to lesbian couples,
yes.
Obviously there are situations sometimes where there's a more masculine presenting partner in your relationship. Outside of that, what are some of the questions or concerns or medical issues you would want to or need to know to find out who's the best person to carry or go through the procedure?
Honestly, for us, doesn't matter. It's irrelevant. It's really the success of IVF. Doesn't matter whether you're single, straight, lesbian, etc. the age of the egg is the simple, most important factor.
Age of the egg.
So if we have a couple, we have a same-sex couple, and we have a lot of same-sex lesbian couples come to us, and the egg provider is usually the youngest one. Not always. Sometimes the older lady. When I say older, I mean in their 40s. I don't mean older. But you know, in the fertility world, the younger the egg, the better the outcome. So if we have a couple that come to us and one is 32 and the other lady is 42, we'll always recommend that they use the eggs from the 32-year-old.
Because of a higher success rate.
Correct. And then it doesn't matter who carries the baby, because you know all the stories from Italy, from the 62-year-old woman who carried the babies for her daughter, and you know, a uterus will always function. It doesn't matter what age you are as a woman. The eggs start dropping very quickly as far as the quality and the success after 35, 37, 39, and certainly into your 40s. So as a lesbian couple, if you want the best success, you will choose the younger partner to be the egg provider, and then it doesn't matter who carries the baby, because the uterus can be primed for either her own eggs or the donor eggs.
So does fibroids or endometriosis play?
Of course. So what we do is we screen for the egg provider person. So, and even sometimes we have women who have what we call premature ovarian failure. So the 39-year-old might have better eggs than the 31-year-old because she's got premature ovarian failure. So we screen them both for their ovarian reserve, and then we screen them both for their uterine capability as far as carrying, who's got the better shaped uterus as far as condition, fibroids, endometriosis, any adhesions, any previous surgeries, and also remembering carrying a baby, is there diabetes, high blood pressure, etc. So there's definitely, the good thing is with two women is they get to choose who the best person is to carry, right?
Answers the next question. I don't even know. That's great. What is the sperm donor process, and can anyone go through it? Like a catalog or anything like that?
So the first thing is there are many international sperm banks across the world. There is no sperm bank in Barbados. The risk of consanguinity is too high in a small population. Means
Ain't a breeding girl.
I know that. I want her to tell everyone that.
You and your cousin or your brother or your father's place.
It's so true, because you could be like, there's this saying, especially in my family, like, you don't know who's your cousin until you go to a funeral, and then you see all your cousins like, no, that's not my cousin. You get to the secondary school, no, that's your cousin.
So, and in Barbados, there's a very high risk of that. So they don't need us to be adding to the pool by using,
last thing they need.
by creating a donor sperm bank. So anybody who uses donor sperm in Barbados Fertility Centre will bring their donor sperm in. It's really easy process. FedEx ships donor sperm here.
I was going to ask if I could come to the airport, but then she said bring it in.
FedEx.
So ship it.
Yeah, so the woman or the couple who are using donor sperm, they go onto the sperm banks. We have about 5 in the US that we work with, and they just pick the donor sperm out of a catalogue, if you like. They pay for it, and then FedEx collects the donor sperm and ships it overnight here. And then we put it into our freezer here until the couple are ready to
someone
use
ship it to their house, or it has to come here?
No, they can't.
How did they ship it?
Wait, it doesn't. If I'm thinking about it, that's a valid question.
It is a valid-
right? Because
Yeah,
someone
that
would
quite
think
a lot.
about, maybe can I just ship it to my house and do the whole turkey baster and get it over it,
Yes,
right?
people
See?
ask us that.
It's a valid question.
I'm
Just because
sorry.
you haven't thought about it. My first thought was, well, maybe I can do this on my own. I don't need you guys, but
I mean,
clearly I do.
Well, you actually can.
There wouldn't be a
You
wrong.
actually can, but the clinics don't ship to anyone except a doctor's office. In theory, you could do that at home. The sperm could be delivered to you. You'd have to be sure it was delivered right at ovulation time, or it would go bad in the cupboard. But it is possible, but the donor sperms clinics don't ship to homes. They ship only to clinics.
And just because I work in a lab, like biohazard, like you can't put that in the fridge. You can eat cheese out of
Well, you could if it's in a sealed container.
Oh,
Thank you.
no, girl.
No, but I mean, like, literally for me, it was like, oh, nope, this has to be all medical. I'm not, no.
But there are most
Shit.
likely people that are thinking, well, maybe I could just have it shipped to my
But it's a good
GP.
question. So
Right.
now you know.
So starting back from where we were talking, when it comes to, oh Lord, what the hell is that? When it comes to hormonal imbalances and the success rate of the eggs, how can that really affect, again, the success rate?
Well, it depends on which hormone is imbalanced.
Talking from the...
We keep forgetting there's so many hormones.
So if it's like the anti-Müllerian hormone, which detects the ovarian reserve, if that's low, you can't correct that. Okay, that's the path your ovaries are on from the day you were born. There's no way to change your ovarian reserve. It's what eggs you have left in your ovaries, pretty much. If it's progesterone, it's easy to fix. If it's just a hormonal imbalance where you're not ovulating, it's easy to fix. So it really depends on what the hormone imbalance is. A lot of women have polycystic ovaries, which is a hormone imbalance. Again, we just give a little bit of ovulation induction meds. You have to help each part of the menstrual cycle if you want with hormones, but most are correctable. Only the ovarian reserve is not.
So what's the difference between estrogen and progesterone?
It's different parts of the cycle. So at the first part of your cycle, in the first 14 days, if you have a normal 28-day cycle, you produce FSH, which is your follicle stimulating hormone, which starts to produce the egg. And as that egg matures and grows, your estrogen levels go up. Okay, when the estrogen level hits a certain level, it then triggers ovulation, and then you get your LH surge. You get a peak of LH, and then as your LH surge starts to drop, it triggers the progesterone to start to be released. And the progesterone is what we call in the luteal phase, and that helps with the implantation, to support the implantation and the pregnancy. So in the third phase of the cycle, so there's the follicular development phase, then there's the ovulation phase, and then there's the luteal phase. And the luteal phase is where the progesterone is. And if implantation doesn't occur, the progesterone drops, which triggers the FSH to go up, and the estrogen goes up, and so on it goes in a cycle.
Okay.
I'm not right over my head, but it sounds like she knows what she's saying.
Right? Yeah, period, not things.
Okay, so can you tell us what is surrogacy and if it's legal in Barbados or mostly Eastern Caribbean?
So surrogacy is where your womb isn't functioning, either because of hysterectomy, from cancer, from fibroids, or for same-sex male couple that don't literally have a womb between them. So there's a number of reasons why people would need to use a surrogate. A surrogate is simply somebody who carries the baby for you. There's usually no genetic component. In other words, it's not her eggs, and obviously not her sperm, but she is what we call a host surrogate. Really just carrying, almost like a warming oven.
That's
right?
what I was thinking, but I thought it was really rude to say, but you said that's not rude.
Well, we're doing the layman's term.
Like
so she is carrying the baby. Surrogacy is a wonderful thing. Most women do it because they get paid pretty well for doing it. Obviously, it's a 10-month commitment, and stay-at-home mothers do it often, especially in the US. Stay-at-home mothers, they've had 2 or 3 kids themselves, they're at home, why not be pregnant again? They had no problems medically, they're well, they had easy pregnancies, etc. There's very strict laws that govern surrogacy. Like in California, they have a property law, and the property is the eggs and the sperm or the embryos belong to me. They're my property, and you are carrying my baby. And that's where the line in the sand is. It's a property transaction. You're carrying my baby. At the end, when you deliver, you give me my baby back. It's my property. And it's really easy to work within a legal framework like that. Unfortunately, in Barbados and in the Caribbean, we don't have those strict laws. And there are many surrogate cases that can go wrong. So something happens to the baby, it has Down syndrome, the intended parents don't want it back, or the surrogate mother doesn't want to keep the baby. There's a lot of surrogacy needs to have a very structured legal, very well-defined legal structure in which to operate. And unfortunately, we just don't have that here. It's not that it's illegal, it's just not
a mechanism in place, yeah.
correct. And the other thing is that it's what name goes on the birth certificate. So in California, it's my property, so I get my baby back and my name goes on the birth certificate. But in Barbados and in the Caribbean, you had the baby, you had my baby, and your name would go on the birth certificate, and then I have to adopt my baby back. And then you have to go through all the social workers and so
Paperwork.
That was like
and
that in
processes.
any hour. They went
Adoption
through that
in
where
Barbados is a
so it's
It's-
just
yeah.
not structurally and legally set up for this. And that's really, it's really easy then, because we can just say to people, we can't help you with surrogacy, but what we do for a lot of couples is we will create the embryos here because we're a really good clinic, we're cost effective, and so they know that the embryos that we will create are really good quality, and then they will take the embryos and ship them to the clinic where their surrogate is. We've had a Trinidad couple ship their embryos to a clinic in Mexico. They have 2 children from the
I was
surrogate in
going to ask
Mexico.
you that. If I could do that, if I could ship my
Correct.
or if I can have
We have a
someone
couple
come
that
here.
ship their embryos to LA, and in fact this month in the clinic we have a same-sex male couple, and they're shipping their embryos back to Canada for a surrogate in Canada. So there are many options to do surrogacy, just not here.
That's amazing.
That was pretty good. Also, I was going to ask, because I feel this is going to play a very big part in the whole surrogacy thing, especially when it comes here. I'm guessing it also has to deal with the emotional stability and also maybe the just general stability of the person that will be carrying the embryo.
They also have to go through counselling.
True.
So the screening for a surrogate is immense. In California when I worked there, they fill out document out after document. They have to have a social worker go to their house. They have to have counselling. You can't just sign up to be a surrogate and then keep partying. There's visits that they get every week. Be sure that they're following a certain diet. It's a huge.
I have a question. You said that you don't take eggs. You don't take sperm from here, but do you take eggs, donor eggs from Barbados?
Yes, we do.
That was the process for that. Like, if I decided that, I'm not ready to have a child, but I don't mind going through the process of giving my egg or eggs. What was that process?
So we have a very successful egg donation program here. We screen for anybody coming through with donor sperm, donor eggs, etc., including the egg donor. We have to check them medically, check their egg hormones, check medically they're okay. They have to go through psychological counselling, the same thing. Be sure that they know they're relinquishing their eggs and any rights to any unborn child. And so they have to be considered a fit donor. That they are usually between 20 and 34. Usually a history of fertility, either if they've had a termination or a baby themselves, just so that in theory we know that their gametes work, their eggs work. But they have to have a normal hormone profile, etc. Go through the usual medical screening, physical screening, emotional, psychological screening. And then you would take injections for about 10 days and then have the egg retrieval process. Our donors in Barbados are reimbursed 1,500 Barbados dollars for that process because they have taxis, they have days off work, they have inconvenience and expenses that they have to meet, childcare for their day of their procedure, etc. So, and it's not an easy process. To be a sperm donor, it's a pretty easy process. To be an egg donor, it takes a lot. They have to attend many appointments, usually about 5 to 7 appointments, take injections, and have a surgical procedure.
So how many eggs are usually harvested?
Usually our average egg number is between 8 and 12. Our donor average egg number is about 15, and that's pretty normal.
Sounds like easy 10 grand a month if you get any.
No, you can only donate.
I mean, that's a good question.
You can only donate 3 times.
3 times? Okay.
And each donation process takes about 2 months or so. By the time you start the pills, start the injections, go through your monitoring. So, but yeah,
It's a commitment, really.
it is a commitment, but it's a commitment they feel really good about. There's a great sense of altruism about it. They're really helping another couple to become parents.
That's great.
So,
Yes, please.
what is the cost And list or range of services you provide, such as consultation fees, screening process, when we're alternate candidates.
For couples, for donors, for
I guess everything.
Couples?
Yeah. What I do know is that you guys apparently have some of the most affordable rates in the world. That much I'm aware of.
Mm-hmm.
So our initial consultation fee, whether you're a single female, same-sex couple, doesn't matter, is $250 Barbados dollars. That's usually about a 45-minute appointment, and at that appointment the doctor goes through all your past history. From then, it really, the route financially that you take depends on the route medically that they want you to go on. But first is usually the bloods to screen for your ovarian reserve, check your tubes. Some people come to us knowing their tubes are blocked, they can skip that step. Some people come to us knowing they've got a low sperm count, we can skip that step. We don't repeat any tests unnecessarily. So if they bring results to us, we're able to use them. So really, depending on what previous investigations they have and what tests they need, the testing can range from anything from $100 up to $800, depending on how much they need. And then depending on the results will depend on if they need just fertility tablets and a scan, $150. If they need an IUI, where we wash and prepare the sperm for mild male factor, where they have sperm a little bit lower than the normal range but not severe, then the IUI is about $750 Barbados dollars, and that includes the scan, the washing, the preparation of the sperm, and the procedure. And then obviously there's the IVF, the in vitro fertilization that we talked about earlier, and that is 10,000 Barbados dollars for basic IVF, 12,000 if there's a male factor. So they need to inject the sperm into the egg, because that is called ICSI, intracytoplasmic sperm injection. That's 2,000 on top of the IVF, because it's a very lab-intensive procedure. So that's 12,000. And then what that doesn't include is the medications. The medications range, because I'm not going to give this, well, not me, the doctor's not going to give the same dosage to a 42-year-old to produce eggs as she is to a 30-year-old to produce eggs. So the price range then for the medications depends on the individual patient. What are their hormonal needs? How much medications do they need, and for how long? That medication cost can range anywhere from 2,000 Barbados, but it can go as high as 6,000 Barbados, depending on their medication needs.
Sorry, you talked about washing the sperm. I know that's a term I heard within HIV referencing.
Yes.
So could you give us a little more details on that?
So the sperm comes out in the ejaculate contains many nutrients, etc., fructose, enzymes, etc., and it's makes the uterus very crampy. So that's why the sperm in sexual intercourse is ejaculated into the vagina, and then the sperm swims up through the mucus, leaving all the fluid behind. That fluid doesn't actually go into the womb. So when we take a sperm sample into our lab, we take the sperm and we wash it, and we wash all that seminal fluid off the sperm. So what we're left with literally is just a concentrated amount of sperm without any fluid, and that's called washing the sperm. And when you wash the sperm for HIV positive men, you wash away all of the virus, correct, that is in the seminal fluid, and you're left with just the sperm, because the sperm doesn't carry the virus, it's the seminal fluid that does.
If a person or a woman wanted to have her eggs fertilized and then refrigerated, is that something you guys do as well?
Well, we do what we call egg freezing. So egg freezing is an excellent option for women who are either single, career, hasn't met Mr. Right, hasn't met Mrs. Right, whatever it might be along the way, but they're getting a little bit older, and you know, the reality of the situation is, no matter how old we get, we feel 18, right? And so
until your knees start to
hurt. We have many women in their 40s that say to us, but I eat well and I exercise and I feel healthy and I'm blah blah blah, but it doesn't matter, your eggs are still 44. And at 34, your eggs have a 60 to 70% chance of working. At 44, they have a 2% chance of working. So
That hard?
with that quickly, it goes down. So any woman between 30 and 37 are ideal candidates for egg freezing, where they take the injections, we freeze their eggs, and then if they do meet Mr. or Mrs. Right at 44, they can come back and use the eggs that they froze at 34. And that way their success rate is still 70% rather than 2%.
Is there a continuous fee to pay you guys while you're freezing, while you're keeping the eggs there?
Yeah, there's an annual storage fee of $1,000. The first year is included in the cost of the egg freezing cycle, but after that there's $1,000 Barbados storage fee because we have to keep them obviously
That's
frozen.
not bad.
No.
Yeah, it's not bad at all.
They're really true and they're affordability.
I have a question. So if someone decides that they don't want their egg anymore, can they donate the egg to someone, or do you
Yeah,
just
discard them or donate them.
okay?
So
That's pretty
if
awesome.
they don't want them, we just take them out of the freezer and dispose of them, because literally once they've thawed and they're not in the right media, they just perish. Or they can say, look, I don't want them, I'm done, I don't want to
Donate
come
it to
back,
someone.
and donate it to a couple.
That's amazing.
So what's the process for the discarding?
You just done. You thought it was going to flame or something.
Well, no, it has to be put in a biohazard safe,
Right.
sharps container, but it's
Just
once
like-
they are not out, once they are not in their freezer, and once they are not in media, they're not in a warmed state, or in the body, they will just perish.
Okay. Back to the sperm washing thing. Are PLHIV, persons living with HIV, suited for this process? Like you kind of touched on.
Well,
Sure.
look, I think, HIV is such a, what they call long-term disease now. It's not like it used to be. So we have had HIV female and HIV male couples come to us, and they have to sign an additional consent form, and they need to have a certain viral load, which is below a certain amount. In other words, their HIV,
Undetectable.
correct, their HIV has to be managed and manageable, but it's really a chronic disease now. It's not like not like the death sentence it used to be, right? So we wash the sperm if the male partner is HIV, but they have to sign a consent saying we can't guarantee this is HIV free, but it is as good as, because there's a risk to everything, right?
True. Risk reward.
Yeah. So, but yeah, we do. That's.
Have you had any cases of vertical transmission?
No.
Okay.
Also, I was wondering because again, I don't know. You might be familiar with a swimmer. He's from the UK. Tom Daly.
Yeah,
Yeah.
Diver.
I
Yeah.
don't like
He's short and
water.
good looking. I think he's good looking at my list.
He's
Girl,
a
he's a
short.
dwarf.
Actually,
he's a
when the
short
first time I saw him, I was
figure.
like, "You're gay." No, and he didn't know. Like me and him interacted, but the first time I saw him at Olympus, I was like, "I am getting the gay vibe off you." And then, like 2 years later, he came out and was like, "I knew it."
But I brought him up because the talking about this was like, I feel like maybe, and again, it might be not, it might be true in my head, or like, it's like a high chance that maybe he came here to get his stuff done.
Well, what you want to
That's speculation. I will avoid that question. Thank you so
Actually, no,
much.
he didn't come in
Education
here.
confidential.
That's you can't answer anyways, right?
But I mean, at the same time, with the affordability and the
But
safety
she
that
still
they get
can't
from-
answer the
I know.
question.
speculate.
I
know.
actually have, you mentioned that 90% of your demographic comes from overseas, and I do know from your social media that you market the beach. So can you tell us like that whole process of when persons come, how do you put them at ease by helping them?
Well, here's the thing: is that when we first set up the clinic, Barbados has a name across the world that we don't need to advertise. All we needed to be was a good fertility clinic, and Barbados would do the
Yes,
work
right.
for itself, right? So we knew we had to put in a world-class clinic, and then people would come. So, but so many people, even from Trinidad, they spend so much time in traffic in Atlanta, Georgia, in Miami, trying to get to their clinic in traffic. Oh, I'm just going to the dentist, telling their employers that they have another appointment, and oftentimes people don't share that they're going through infertility treatment. So it takes all that stress away from them. And oftentimes, well, before COVID, when they used to fly in the day before their appointment, they would literally fly in the day before, and the next day they'd be in the clinic for their first appointment, and they're there in their like proper attire, and they're, yes, lovely to meet you, and all very
All the
serious.
formal stuff.
And then we say to them, look, you know, it's very important while you're here that we'll look after the medical side, but you need to look after the emotional side, because we know it's stressful. And infertility is a very stressful journey. By the time they're sitting in front of you, they've usually done 3 to 10 years of trying, failing, not getting through, trying different routes, taking hormones, taking supplements, fighting, crying. So for them to sit in front of you comes with a long track record usually. So we say to them, look, this is the time for you guys to be together and heal. We'll look after the medical side. We need to scan you again in 2 days. And you can see them visibly relax when you say that. And then when they come back 2 days later, they're normally in their little beach top,
Well tan.
their little tan, the beach, the sand on their feet. And the difference in just 2 days of them absorbing the sea and the warm air and the just time away from traffic and family. Oh, what are you doing now? And have you gotten pregnant this month? And you know, all of that,
Stress.
it just really instantly almost melts away. And so the other thing is that when the patients are in a really nice mind frame like that, and even for people across the Caribbean, you know, they might come from the most beautiful islands like Antigua or Anguilla or Turks or whatever, but they never appreciate it. And so only when they're here and they get that moment to be a tourist themselves is when they also relax. And people who are, it's studies, 100 studies, time and time again will show you that the lower your success rates are, the higher your pregnancy rates are. And so, you know, that also contributes to our high success rates is our patients are really in a better place. They are trying to find a parking spot to get in for their transfer and they're late, and, you know, as opposed to them just walking in the door and being in that mind frame that's ready.
Yeah, and you talk about walking in the door, but walking into the lobby there was very relaxing, like the carpet floor, the very calm colors and pictures of the baby. So it is clear that you're doing that. You're trying to make them as comfortable as possible. And I appreciate you taking the time with us as well. This is very comfortable for us.
Okay.
At least for me, I should say.
Pause. Time?
7.
Okay, so one last question.
Okay.
Do you
Oh, dear.
know
I don't want to know. She said goodbye.
I was getting ready to wrap her. Like, no. One last question.
intersex? So have you had any intersex patients?
We have not.
Okay.
What does intersex mean for people like me that don't know all these fancy terms?
Intersex is somebody who has
Both
Male-
male and female.
male and female.
Hermaphrodite.
Yes.
No, they did that.
What? That's not a term?
That was
a term.
So it's not the correct
No,
term anymore?
maybe,
yeah.
Well, I don't know. They say, but I don't know the God people that don't
That's true,
know.
because more
So hermaphrodite is not the
Please
correct
don't
term to
say
use anymore.
hermaphrodite anymore.
Okay, intersex.
Intersex.
No, I've learned.
So if you do have an intersex patient come in, what would present a problem or a greater risk or anything that may or may not contribute to them being a viable candidate?
I honestly don't think anything would prevent them from being a viable candidate. I guess I don't know because we haven't treated them, but we would certainly just take their case under evaluation to see what we could do to help them. You know, I mean, if we could get sperm, then we could use their sperm. You know, we can retrieve eggs through the wall of the abdomen if they don't have the vagina. It really depends on their individual case. But we are open to meeting with them and having a consultation and talking to them and giving them options.
That was definitely the last question.
True.
Thank you so much.
You're welcome,
Yes.
indeed.
It was,
Appreciate
it
it.
was actually really good. I enjoyed this.
It's very educational for me.
Yes.
All right, well, I'm going to go back to work
now.
I already
might
plan
do
to have to
the
get my
I
my
gotta see
sperm.
what happened
I'm gonna
already.
look online for some sperm, and probably in 2 years' time I'll get my eggs.
How old are you?
I'm 32, so I got to come in 2 years.